Hello everyone, I'm Joe Cordeiro, your police chief for the city of New Bedford, and welcome to another episode of Meet NBPD. I have with me today my very good friend, Damon Chaplin, who also happens to be the director for the health department for our city. Welcome, Damon.
Thank you for having me, Chief.
Oh, it's a pleasure having you. Time to spend some time with you. Damon, maybe you could tell some of our residents at home watching a little bit about yourself and then what we're going to be talking about today.
Yeah, my name is Damon Chaplin, Health Director for the City of New Bedford Health Department. I've been here for just about 3 years, transplant from Boston by way of Brockton. Been in public health, both local and state public health for most of my career, and happy to be here. Wishing this was under different circumstances, but we'll get through this thing.
Absolutely. We're going to be talking about what's going on with this whole pandemic with COVID-19 and what we can do about that. But if you're going to have to get through it anyway, this is the place to be in New Bedford. And I know when I talked to Damon, who, as he said, is a transplant, he says this isn't a better place to be. He loves New Bedford. And I think that's probably what I love most about you, Damon.
Yeah.
Your love for our city. So what can our folks at home, what should they be doing right now to protect themselves, their loved ones, and more also importantly, the continuous spread of this pandemic?
Yeah, we're not over it yet. We're actually seeing a slight second surge within the state and also in New Bedford. So the things that we like to tell people, all the things that got us here will get us through this next set of surges that we're seeing. So washing your hands, social distancing, wearing PPE or masks when appropriate, limiting the number of large congregations or group settings of people together. This is the year we ask that if you can, please do go get your vaccine. Your flu vaccine is very important because it helps to free up those hospital beds that, if we happen to need them, they'll be available. So getting as many people vaccinated as possible is also, I think, something that will help us get through as well. And then lastly, just being smart about your engagement with other people and with groups, keeping those down, smaller group as possible. I know we're coming on one of the most popular holidays of the year, Thanksgiving, and so
my favorite.
We're asking for families to be smart about your travel, be smart about your engagement, and when possible, try to keep that central family unit together as best as possible for the holidays.
And when you brought a whole lot of things that I want to ask you some questions about. So let's talk about, first of all, you were talking about wearing a mask, washing your hands, being smart out there. And I do see a lot of people wearing their masks, but I do see them wearing kind of like this with their nose completely exposed.
Yep.
So that's not really doing us any good, right?
No, the masks are a primary source of prevention for us right now, and that it helps to maintain or control the amount of droplets. And so this virus is carried through droplets, whether it's through the nose or through the mouth. And so when you're wearing it as a chin strap, as you have demonstrated, it's really not, it's only doing half the job. And so the other half of the job would be to have it, make sure that it's over your nose and your mouth completely. And again, it's to protect you and to protect others from you in the event that you guys happen to be less than 6 feet apart.
Right, and washing your hands, and that's why the mask and the washing hands comes in are so critical, right? Because we touch our face so often that if we're not washing our hands all the time,
Yep.
That's what the mask really is, protecting ourselves from literally infecting ourselves.
Correct.
Right, now, the other thing you brought up, my favorite holiday, Thanksgiving, is coming up.
Food.
Turkey, food, everybody gathering together,
Yep.
and organizing. So I know the governor just came out with some new restrictions, and I think he's talking about you can only have 10 people in indoor settings, reduced from 25. Will that impact families having dinner at home for Thanksgiving, with their extended families?
Yeah, it's going to impact us. We're a big family, and we tend to have large gatherings around Thanksgiving. And so we're trying to reduce those numbers and asking folks who normally would come together just to hold off for this particular year. And so it's a temporary discomfort right now. You just have to hold off. And if in some situations there are some folks who are able to be outside for a good portion of the time, that they're together. That's also helpful as well. So being outside is, if you can, is helpful as well. Maybe we'll have a warmer Thanksgiving than we have in the past, and people will be able to be outside, as you know, and increase that social distancing.
Right. Some of the other restrictions, we can talk about them as we go along. Some of the latest restrictions, like literally hot off the press today. But he's also mandating, or he's reinvigorated, that everybody must wear a mask out in public. Is there any fines for that, Damon, coming from the health department if you're not wearing your mask in public, at the supermarket, picking up your kids from school? Church, for example?
We have not, as a health department, we have not been penalizing folks for not wearing masks in public. Typically, those fines are being given out to the business owners, typically in commercial settings. This would be a new wrinkle to the enforcement process that we have here in New Bedford, and so we haven't had to do this part yet. Actually making sure people are wearing masks in public, in all public spaces. And so that's going to be a bit of a challenge, and so we'd have to figure out what the best route for enforcing that. And really, enforcement is about compliance. It's more so about compliance and about education, in my opinion. And if there's someone that we see, we'd much rather hand them a mask than to hand them a fine for not wearing a mask. And so that's what we would prefer to do.
Yeah, we would too. I mean, no one really wants to be the mask police or the
Correct.
sanitizing police, especially during these times when literally this piece of cloth can save your life or the life of your loved ones back home, so you don't go home and infect them. And we know that disease is impacting people differently, right?
Yep.
Some people are more resilient, have a quicker recovery, and many others, they've lost their life to this.
Yep.
So it's so important to really do that, and compliance is to your point. Our experience, and maybe you can share your experience as the health department director, going out there at supermarkets. The police have been going out to supermarkets, churches, and bars and restaurants. We've been finding an incredible amount of compliance from the people here in New Bedford, which, by the way, I want to say thank you. It just makes everybody's life easier and safer, for sure. So maybe we can talk a little bit about that.
Yeah. So I want to reiterate what you just said, Chief. We are seeing a tremendous amount of compliance within the city. We're going to those areas where we're hearing about complaints of folks that are not upholding their end of the bargain and doing what they're supposed to be doing. We go into those restaurants and to those stores and those locations, again, to remind folks, sometimes it's with the fine and sometimes it's with the closure, but to remind them nonetheless of the importance of following the rules. But by and large, we're finding a tremendous amount of compliance among New Bedford residents, and what we're seeing is that our numbers are showing that a lot of the influx in numbers that we're seeing are coming from outside influences outside of New Bedford. And so, it kind of speaks to this need for a regional approach to infectious disease control. And so that's something that we're going to be talking about on a larger scale coming up in the next few weeks or so, both at the state level and at the local level, about this regional approach to infectious disease control.
That's a great point that you bring up, especially here in New Bedford. We like to refer a lot of times to Greater New Bedford, right? We really don't have borders. A lot of the folks that were born or even raised in the city have moved into the suburbs, but they still have family or they work here. So there's this constant crossing borders, if you will, and that's why I think it really needs to be a regional approach, as you said, Damon. What efforts is your department doing in conjunction with the budding communities to do that?
Yeah, so right now, the health department, we're co-sponsoring a bill, SAFE 2.0, which is a bill that's going to be coming up pretty soon. We're going to be having a hearing with the legislatures that talks about improving the infrastructure for public health in Massachusetts. In Massachusetts, we're very unique. We're ultra-local. We have 351 independent health departments. There's no other state in the country that's like that.
Wow.
And so we don't have a county form of government here, county form of public health here. And so in lieu of that, we have to create or develop these public health districts. And so the bill that's coming out that we're pushing forward is going to ask for, one, sustainable funding, but two, we're going to be asking that the state develop standards for health departments, for each health department, so that each city has a credentialed health department, and so that the disparities around access to health care and other services, we try to eliminate those through the Safe Bill 2.0.
Wow. It sounds like you have your hands full over there, Damon. and you have an incredible staff that's going out there. Maybe you can talk a little bit about what your staff is doing as well to ensure the safety of everyone at home.
Yep, we have a staff of roughly around 22 staff. We have 7 inspectors. We have a chief field inspector. Have outstanding senior managers, both Assistant Director Stephanie Sloan, Administrative Assistant Christine Cunningham, and then we have a number of other program and grant managers that are just working really hard to keep the office afloat and working properly. Our hours have now, the mayor opened the health department's hours, so now we're open from 9 to 1 every day, Monday through Friday. And so with that, you know, we're trying to get back to some level of normalcy, and we're trying to do reopening and COVID at the same time. And it is a challenge. It is a challenge. For a city this size, we probably have half the staff that we would normally need for a city of 100,000 people. And so each year we're slowly trying to figure out ways to grow our staffing so that we can meet the demands of the city. And so, you know, like I said, we traditionally, most health departments, they get a general funding from the city, and then they have to go out and compete for categorical funding through grants. And so that when New Bedford is no different. We take in about the same number and amount of grants that we do from the city. So, you know, we do a pretty good job of going out and getting grants to help complement the work that we're doing.
Well, when I'll say it, you're a humble man. You guys are doing a fantastic job. You're not doing a pretty good job. You guys are doing a fantastic job. You know, you and yourself, your staff, and we know that starts with you. So thank you for what you're doing and how you've been doing it. We're coming on break time, so folks at home, don't go away. Don't change that channel. You want to go grab a snack or something, go ahead and do that. And we'll meet you back in a few minutes with me, NBPD. See you soon.
We are your local crisis center, and we are here. We are here for you whether it's day or night. We are here for you when it feels like there's no one in sight. We are here for you when all you feel is darkness and could use some light. We are here for you when you don't feel like you and you feel like you just might lose control one day and lose this never-ending fight. We are here to battle with you and help you rewrite a better tomorrow and a future that's bright.
Hi, my name is Christopher. I'm Emergency Services Manager here at the Crisis Center in New Bedford. If you or a family member is experiencing a mental health crisis or struggling with substance abuse, feel free to call us anytime. If you need us, we are here for you.
Estamos aqui para ti. A gente estamos aqui por você.
Não está ali, por favor.
Merge I know I'm not worried. I get caught girl. Cook up a cup man. Okay.
We are here.
Welcome back to Meet NBPD. And with my great guest here, Damon Chaplin, we left off. And let's talk about what we sort of ended with, food, right? We're both foodies. You like food, I like food.
You like to cook.
We both like to eat. and Thanksgiving is really coming upon us. It's a big family holiday, as you put.
Yeah.
And it's tough. These are hard times. It's hard, you know, when people are getting sick. But it's really hard to stay away from the people that we love, people we care, family, friends, and we're social animals. We like to socialize, and food is usually in the middle of that. Can you talk about how important it is for us to resist that temptation, that urge?
Yeah, you know, one of the other things that we're fighting right now, outside of the virus and the disease, we're also fighting fatigue. And we understand better than anyone the level of compassion fatigue, the level of general fatigue, and so we ask that you fight the fatigue, and you resist the urge to do less when you really should be doing more. If you happen to be a person and you're either the matriarch or patriarch of a family, it's important that you set the standard for a culture of safety in your place. And so when we say that, we mean that you may have to be the person. If someone is not feeling well, you just tell them we'll bring you a plate, but please stay home. You may be the person who has to be the first one to put a mask on and say, you know what, this is not to make you feel any kind of way, but I'm going to put a mask on. And so you normalize good behavior. And that's really what I think the key to getting over this second hump is normalizing good behavior.
Yeah, Damon, a really great point. It's hard. It's hard because as human beings, we're created for social interaction. I love to hug people. I haven't been able to hug people since this whole darn thing started, but that's what we're used to. We're used to this human touch, this human interaction. And you're right, we got to resist the fatigue of being tired and be worn down by it. It's a marathon. And it looks like maybe you're halfway through that marathon. And speaking of that, resisting that, when you're not feeling good, going out, restaurants, going out to eat at restaurants, again, wearing that mask, getting up and putting it on when you got to go to use the facilities, washing your hands. But the governor just came up with a new restriction as well. Did you want to talk about that as a time frame now?
Yeah, that was just about an hour and a half ago. I came out with the restrictions on restaurants being open. I think they're going to be closed by 9:30 going forward. I'm not sure if there's a date on when that's supposed to take effect. But the restaurants will have a curfew and will need to be closed by 9:30 going forward. And again, I think that's more so about, and I understand where the governor's coming from, it's about reducing the opportunity for larger congregations. Again, it's the activities that people are doing that's really driving or increasing the risk level. And so after a certain period, whether you're in a restaurant or a bar posing as a restaurant, wherever you happen to be, after 10 o'clock, the facility tends to change to a more social facility. And so those create opportunities for infection and also increases the risk. And so I think closing at 9:30, I know it's putting a financial strain on many municipalities and many cities and many businesses and many families, and I understand. My wife is an entrepreneur herself, and she is also struggling to kind of maintain through COVID. But I think that these are smart requirements from the government, from the governor, to restrict the number of people congregating after a certain period. So I think it's a good first step. I think that we're at a different place in this disease now. When we started this in February, we were coming from indoors, going outdoors. And so right now, we're doing the exact opposite. We're going from outdoors and going back indoors. And so we just have to be cognizant of that going forward and make sure we put strategies in place to help protect us.
That's a good point. Again, you make the moan about going from indoors to outdoors and outdoors back into indoors. But it goes back to some of the basic things you've been putting out there in the government as is wear your mask, wash your hands, keep your distance. Now we're going indoors and we're taking that social interaction inside. We really have to limit who we're doing that with and who we're allowing in. We shouldn't be allowing anybody in our home unless they live there. Correct. Pretty much. Am I correct?
Yep. And that's pretty much the family unit is those folks that you eat and sleep with, and so this is going to be a challenge for many of us. We did not have to deal with Thanksgiving, Christmas, and New Year's last year, and those are big social events. And so, again, this is the time for everyone to do their part. and take and pick up their the mantle, so to speak, and carry this thing forward so that we can get to next spring with fewer lives lost.
Right, Damon. You're absolutely right. We're heading to some major social events. We had one in the summer. It was the 4th of July, but it's outdoors, so it's a lot easier to manage. But heading into this tough season, I think you talked about fatigue, and maybe you can talk a little bit more about it, how we have to really be vigilant and disciplined and not getting involved with these social interactions. The more we are now, the more we do now, and it's painful and it hurts and it's hard, but the less pain we'll endure later on. You know, losing a loved one is extremely painful, and the more we can do now to prevent that, or prevent someone suffering through that disease to recovery, it's best to be well disciplined, and maybe you can talk about that.
Yeah, and so as many of you who are listening today, you may know someone who was sick. I know a few people who are sick. We've lost, by family, we have lost some people this year to illnesses related to COVID. And so, you know, it becomes this fight to kind of prevent yourself from doing what really comes natural. And so, you know, even so much as just picking up the phone call and calling everyone to organize an event, you know, we just ask that you resist that urge. You know, if you're the person who normally has everyone over to your home for the big meal, we ask that you do smaller meals, and you just really resist the urge to have, you know, a house full of people, because what we're finding in our numbers, we're finding that there's either travel, workplace, or household contact. That's how people are spreading this virus right now. We did a really good job early on in the summer and in early summer and late spring in standing up these systems that allow us to mitigate some of the things that we're facing now. And so we are not really seeing the huge clusters anymore that we did before, that we saw in the nursing homes, and we saw in the fish houses, and we saw in some of the other places of worship. We are now seeing these micro clusters, and these micro clusters include, you know, anywhere from 5 to 6 people. But oftentimes they can be traveling to a location in a car or in a van. Sometimes we can see them at work, but oftentimes we're seeing them at home, where people are either at work and they're bringing these things home, and then that family unit now is becoming infected. So, you know, it's just really important that we stay diligent about the number of people that we are around, and the types of behaviors that we're engaging in when we're around these folks. And so, again, small versus large, outdoors versus indoors, and so that's what I would recommend.
Yeah, Damon, and I think what, correct me if I'm wrong, the gist that I'm getting from you is we all need to do our job. We need to do our part, play our part in this big, big fight. And let's make no mistake about it, there's no joking around this. This thing is deadly.
Yeah.
This will kill. We're talking about saving lives. Not only our own, our individually owned life, but those of people that we love and care about.
Yeah.
So it really comes down to that, right? In this big fight that we're all in, that we didn't choose to be in,
yeah,
but we're all in, it really means that we all got to come together. We all have to do our part 100% of the time. Wearing a mask, washing our hands, keeping distance, and avoiding these gatherings, these social interaction gatherings. Is that really the gist of it, if we have to be truly responsible for everybody by doing our part?
Yeah, and a big piece of that is if you're not feeling well, stay home. You know, that is probably the one thing I can say to anyone that's listening right now. If you are not feeling well, stay home. Just simply.
How about the folks that are home with you? If you're not feeling well, how does that play with the family members that live with you?
Yeah, so in some situations, you're not able to segregate very well in your own home. And so in that situation, you know, you do the best you can with what you have. You know, there's some folks who 5 or 6 people who are living in a 1 or 2 bedroom apartment. It becomes very difficult to segregate. And so if there's an opportunity for you to go to, to separate yourself and your kids from the person that's sick, or if the person that's sick can go someplace and isolate. Those are recommendations that we ask if that's available to them. But it's hard. There's no easy way around it. If you are living in a congregate living situation, it becomes very difficult to segregate.
Some tips, Damon, on if you can't segregate, you just can't, that's all you have is that apartment. What can they do to protect the rest of the family members who are still healthy and you want to keep them healthy? Open windows, stay in one room. What can they sanitize? What can be done?
Yeah, I mean, the number one thing you want to do is limit your movement within the home. And so if there's a way that you could put partition off a part of the apartment to where you can stay in that particular location, again, for your quarantine period, which is, if you're a positive person, it's 10 days, and if you're a person that's a close contact, it's 14 days. If you can isolate or partition off a part of your unit, limit your movement within the unit, limit other people's movement within your space. Again, opening, this is a more difficult situation. Opening windows in the middle of winter is going to be tough, but if you can get as much fresh air into the apartment and really increase those air exchanges inside of an apartment, that's going to help you out a great deal.
Well, great, Damon. We're starting to come to the end of the show. Where can our residents at home get the best information in real time of what's going on and what they can do to stay safe?
Yeah, number one, I would say go to the New Bedford website under the COVID tab, and we update those that information. We have some trackers there that we update on a weekly basis, and that's a great first start to get information. We also suggest that if you're looking for someone who needs to be tested, we are registered on Stop the Spread with the state, and you can find out where the free testing is in New Bedford. We have Stop the Spread 7 days a week right now, and we have that program will be going right up until December 31st. And so that's another space where you can get great information. Then also the state's website. I think they have a tremendous amount of information relative to what's happening in New Bedford. You can always see the map that's there. We've been red for quite a while now. But again, we have many systems in place that we did not have at the beginning of COVID that are going to help us get through this.
If someone does not have access to the internet at home, is there another way they can get information?
They can call our office.
What you can give our folks at home?
508-991-6199 in the Bedford Health Department, and we'll get you the information that you need.
Great. Well, we're coming to the end of our show. Damon, as always, it's a pleasure to be in your company. I want to thank you for the amazing work that you and your staff are doing for our residents at home. Quick shout out to all the men and women in the New Bedford Police Department that are doing a fantastic job out there, keeping everybody safe. So thank you from the bottom of my heart. And for everybody watching us at home, our residents in New Bedford, I can't thank you enough for the compliance that you're doing every day. I ask you to continue with that vigilance and that discipline to keep yourself safe and everybody else safe. And I hope you do have a wonderful holiday season. Until the next time on Meet NBPD. See you soon.